Hey, how you doing? Good.
I'm standing here with Randy Tobler, and if I could ask you, could you just introduce yourself a little bit?
Sure, Randy Tobler, radio talk show host as a hobby, a passion, and doctor for a day gig.
And tell me, how often is your show on? Is it just Saturdays? Is it?
I'm Saturdays with my political show and my medical talk show. I have another product I do locally near my Liberty Lair, my compound, and then I do a national syndicated medical minute too.
And what station are you on? What channel?
Various stations. In St. Louis, 97.1 FM Talk.
Okay. And you're here today with Show Us the Bill, or what? Can you
Show
tell
us
us
the
a little
bill
bit
and
about
stop
that?
Obamacare. It's a dual purpose.
Okay. And you spoke this afternoon or this morning. Tell us a little bit about what you said.
Well, I wanted to get the message out from my side of the stethoscope. Most people don't understand the challenges that doctors have trying to navigate a lot of government regulation, interference in the patient-doctor relationship. And I want folks to understand how it will only get worse. I wanted to highlight the abuses, frankly, of the profession and how that has a side effect and really spins out to patient care. It decreases space-time and bedside time, doctors and patients, decreases patient choice, and frankly makes doctors very bitter because we're here to serve patients, not to push paper and to satisfy bureaucrats.
They talked a little bit about kind of blaming insurance agents and insurance companies for kind of some perceived failures in care and cutbacks. Can you help us understand what your perspective as a doctor is on changing that sort of oversight from, say, an insurance agent to the government? Do you expect the situation to improve or worsen? What are your thoughts?
Well, when you're unhappy with your insurance company, there's usually another one around. And in fact, if the system was engineered right, like Swiss system is, the Switzerland system, we'd have myriad insurance companies. They'd be niche insurance companies with special benefit plans instead of mandated benefit plans like the government does. You know, the government increasingly, like they did with the mortgage industry, told insurance how to do their business. So they're strapped with those kind of regulations, which really sort of shackles them. Competition works in the home insurance and the life insurance industry. It could work in the health insurance industry if it was allowed to be competition the way it should be. So once again, we have government regulation really sort of shackling what should be a free market.
You mentioned the Swiss system. Could you name, let's let the truck go by first. Could you name maybe the top 3 insurance systems around the world?
Swiss.
Really? It's that?
Yeah, there's really very little other that has the freedom of the Swiss system. And my hero, Regina Hertzlinger, wrote in her book, Who Killed Healthcare, all about it.
Is that the book you have with you right now? Can you hold that up for a second?
There it is. Who Killed Healthcare.
Who Killed Healthcare, okay.
It really goes through a good diagnosis and a prescription for what's wrong with and how to fix America's healthcare. Now, you know, like any system, the Swiss system isn't perfect, but it's a mite closer to perfect than we are. We have some insurance problem, there's no doubt about it. But for cherry picking being one problem where they tend to deny care. You could make portability, though, easily done with some modifications. Could be done.
For people who may not understand the difference, can you explain Medicare versus Medicaid and which patient?
Yeah, Medicare is a federally administered program, and they use third-party administrators, regular insurance companies to actually pay the claims. But it's really a federally funded thing from Washington, D.C., whereas Medicaid is administered through the states, akin to the way the education system works, where the government gives mandates to the states and mandates for coverage and then tells the states to somehow make it work. States can engineer that a little bit too. They're funded, they're given certain restrictions and parameters, and then they have to also, satisfy their political constituencies and meet their economic realities. So that's more of a state-administered program, and it really applies to the poor and kids, whereas Medicare is mainly elderly and disabled.
So with the Obamacare bill coming up, what actions can people take in order to counter it?
Well, what they need to do is get active and call all their congresspeople, senators, and especially not just in your district, but the people like Max Baucus, people like Teddy Kennedy and Chris Dodd, Nancy Pelosi, and let their offices know that you just won't stand for it and that there's a better way. Ask them to have people like Regina Hertzlinger testify, and ask them to actually have them listen to her testimony rather than have it go in one ear and out the other ear.
What about trying to get amendments to the bill or whatnot that might make it a little bit more patient-friendly? For instance, I thought it might be nice to add an amendment that would force a service level agreement on the government. So say that a patient who's going for regular checkup can be guaranteed to be seen by a doctor within a month or something like that. Do you think that something like that approach would have any impact on?
Look, I think anything that brings the patient and the doctor closer together and gets the government out of that relationship is good. But you sacrifice, again, some freedoms because you're essentially mandating how people have to behave. And I'd rather what needs to be done is that we need to let the market work. You need to allow risk adjustment in terms of rewards for doctors taking care of tougher patients, and that can be done if doctors and the government could provide this platform to give transparency to pricing and to quality, and let it stand there. Give people the money that they're currently giving to the doctor in behalf of the patient on Medicare and Medicaid. Give the patient a debit card to the tune of what privately insured patients have, and let them participate in the market and let them make their choices as to doctor, hospital service, and procedure.
Going back for a second to the insurance aspect, do you think it would be of value to force Congress to, essentially be covered by the plan as well? And do you expect that to happen?
No, I don't expect it to happen, and that defeats the purpose. No one needs this plan, not even a sick congressman, a mentally ill congressman, that is, because they need private insurance and the best that medical care can provide.
Great. Thank you for your time, Randy.
My pleasure. Thanks.